My name is Connor Lockwood. I am from the Washington State Department of Health, and currently I am the site lead at the Chelan-Douglas mass vaccination site. I have been at the site since the third day of operations, which was back in January. The site opened on January 26th, so we are just passing our 4-month mark. My normal job at the Department of Health is a regional engineering assistant in the Southwest Regional Office of Drinking Water. Very different, but DOH has been supportive of anybody that wants to get involved in the response, and just ever since the pandemic set in, it was always on my mind, so I've been really grateful for the opportunities that I've been presented with through the department. So the busiest time was probably back in February or so, when we were just opening up and getting ramped up in our operations. At one point we needed to expand because we had too much traffic on the site, and we communicated and worked with our partners at the PUD, Chelan County PUD, and they allowed us to use Walla Point Park in order to stage traffic and make sure that we weren't creating an unsafe environment over here. The National Guard is still here. Today's their last day vaccinating, but they will be helping me transition, pack up DOH supplies and equipment next week. The National Guard has been providing the vaccinators, so figuring out who's going to provide the vaccines or administer the vaccines has been a big challenge that we've been working on, as well as providing pharmacy staff and who's responsible for the vaccine. But at this point that is all squared away, and so I expect a smooth transition. I believe we're the first site to implement PrepMod to have our appointments and record our vaccinations, and so there was a lot of trial and error with that, and so it's just being willing to try new ideas and implement new things. And our process right now with marking the cars and how everybody gets through, we've developed it as redundancy to make sure that we're not vaccinating people that aren't eligible, but just making sure that patients are talking to the right people and just having a pleasant, easy experience without people wondering what's going on. Just communication throughout the site, making sure that everybody's on the same page and knows what's going on at the other stations is extremely crucial to a smooth operation. So we did see a huge uptick when the 12 to 15-year-old age group got approved for Pfizer vaccine. Other than that, it's just been a lot slower than we were at our peak, but that's all right. I mean, at our peak, it was just the lower lot down in Walla Point Park was full, and then observation would be several lanes full, where now it's just one lane or so. So it's just a lot slower, just trickling through, just getting people as they come through, being available. People coming through even before they got their vaccine, they'd be bringing gifts for the National Guard and just showering them with appreciation. And then even after people had come through, they'd come back and be like, we have gifts for you because we appreciate you so much. So it's just been an environment, an atmosphere of just excitement and just returning to some level of normalcy, just some ability to relax. We've been just in this pandemic for so long, and now we're finally getting on our path to recovery and just like normal. And it's just been great, just the energy here and the appreciation of the community. We haven't really had any negative comments, so it's just been fantastic. I will first go back to Olympia and I will check in with my normal office and see what their needs are, but I might go support the Spokane mass vaccination site if they need it, because the mission is ongoing and I would like to help with the pandemic as much as possible.